to the fever clinic and follow the protocol. And coming to the second area, that's a comprehensive dental clinic. All emergency dental treatment are carried out after detailed dental and medical history of the patient. All members of the dental team are trained and minimum exposure of the members are planned.
socio-economic status globally.
Let me give you a question to start with. We've talked a lot about, and I think Dr. Savina was very eloquent about this, about kind of our place on Earth and how all this fits together. So for the panelists, and you guys see a lot of things in your practices and in your day-to-day work. How much of COVID do you think is a consequence of climate change, or of sort of larger forces beyond sort of the typical story of a zoonotic disease that happens to be transmissible from humans to humans, that comes into human populations and then gets spread around the world? We hear, in my world of infectious disease epidemiology, that's sort of yesterday's news. It's not that rare a circumstance, and it certainly happens with influenza quite a bit. But how much of COVID-19 do you think is a consequence of climate change or overpopulation or things unrelated to zoonotic disease? And I'd love to hear our panel, Dr. Jacob, the other Dr. Kuriakose, and the other two doctors Varghese, speak to this point, please.
If I may start with the discussion, Dr. Rutherford, this is Moni Kuriakose from Cochin. So the change of environment and infection in general, yes, there may be a correlation, but most of the practicing doctors like ourselves, we are in silos. We don't think about that in our day-to-day practice. But COVID helped us to force us to think about what could be the reason, and definitely changing the interaction or close proximity of humans to non-human carriers definitely would have increased that chance of newer infections such as COVID-19. It's a learning lesson for all of us, and how to adjust and modify.
Thank you. How, in your day-to-day work, how much has your center had to reorient to COVID, just in terms of patient volume, and I realize you're doing infection control differently, probably, hopefully. Actually, our ear, nose, and throat surgeons really only started to use masks in patient examinations in March. Sort of a great experiment of nature. But how much have you had to change your hospital's practice? How overwhelmed does your hospital feel? Dr. Kuriakose.
I will follow on that. So what we did was we want to make a system-wide change rather than just individual change. So I work in the public sector, so I work closely with the government. Particularly, I look at the cancer side of the treatment delivery. So let me give cancer delivery side that would be applicable to other disease conditions such as Dr. Babu mentioned about dental practice also. So the government at period, first of all, nobody knew the extent of the pandemic. What's the clinical behavior? Nobody knew. So we were and we are still working on in unknowns. So first aspect we considered was that should be prepared for periodic changes. So right from 1st of March onwards, we had a statewide shutdown for about 2 or 3 weeks time. So that was immediate kind of knee-jerk type of reaction. Then after, during that time, that was very important time for us to calibrate, develop policies, and so on. So policy was developed as to what type of treatment should be provided. So that was the first thing. And then how to support them in the community level. So that second aspect was also what's put into place. So that 3 weeks time helped us to organize the healthcare system during that period. Then specifically for each of the hospital, we were asked to come up with policies. And policies was formulated by the health ministry, and that in India, the health is a state portfolio. Even though we get guidelines from the central government, each state has got a mandate to modify, change the implementation of the protocol. So each hospital, what should be done, that was the guideline was given. And this continuously, we are in the process of continuously modifying as we go along. But definitely the basic WHO recommendation we are asked to implement. Challenges were there at the beginning because the resources were constrained. PPE, for example, was not available at the beginning. So we are slowly overcoming and they're getting used to the new norms.
Thank you. The Doctors Varghese, Divya and Richa, if you would please, maybe we get you oh, you are unmuted. Good. You're at Pondicherry Mission Hospital. How much impact has COVID had on your day-to-day work? Is the hospital overwhelmed? Is it something you're absorbing in stride? You know, how's it going in general? Doctors Varghese. I can't unmute him myself, unfortunately. While we're working on that, let's move on. There was a question to Dr. Savino, if I may, please. Despite the concerted efforts of the Ministry of Health in Brazil, as presented by you, can you explain what accounts for the extremely high infection and death rates of people in Brazil due to COVID? What are the reasons for the continued congregation of people in large numbers in public spaces and for not observing the wearing of masks? There's a softball question for you. If you would, please.
Okay. I would just begin to tackle the first question that you have asked on the climate change and concerns to Brazil. I really don't think climate change is something playing a very important role, but the very important role that can explain what's going on, part of what's going on in Brazil is actually the huge inequality, social inequality of the country. So social determinants are more and more proven to be relevant for the spread of the virus, for the severity of the disease. And this is something throughout the world, by the way, and Brazil is really a very hot spot on this social inequalities. And concerning the question by Anjana Mangalari, sorry, I didn't pronounce well, but thank you very much for the question. The 2 words first is to explain that the Brazilian public health system is divided in 3 layers. At the level of municipality states, we are a federation of states, and the whole federation. And what did not happen and should have happened in April is a very organized policy for facing the pandemic from the top until until the bottom of the municipalities. So there was a very long delay for taking some decisions at the level of the Ministry of Health, um, and this disconnected from the levels of the states and the municipalities. So, uh, each state or each municipality decided to go on with his or her protection, public protection. And for example, Rio is in very, very bad shape. Rio de Janeiro is in terms of the pandemic. I live across the bay in the city called Niterói, and it is exactly the opposite, because here we do put a very strict uh, confinement, mask usage, etc., and it worked very well. The circulation of the virus in the other side of the Bay of Rio is completely different as compared to Rio. Concerning the last part of the question, reasons for continued congregation of people in large numbers in public spaces. Well, should I say first that um, it's not only in Brazil, not only in Rio. It happens in France. It now happening in France. France yesterday was at red alarm because of rebound. Um, so it's not only not only in Brazil, but Brazil is very high, and I think it's very high because again we did not have from the top government, very strict, very straightforward um, since the beginning um, towards the use of mask, prohibition. In a second way, the provision of a relevant monetary support for people that need to work um, was very, very insufficient. So this also established something important in terms of spread. I think that despite very important positive actions, and I just cited some of them provided by Fiocruz, but it happened with other institutions. Despite this, we still had some difficulties in really provided a guide from the top to the bottom of the governance in Brazil. Thank you.
Thank you very much. And I point out just a little bit of insider knowledge that Niterói and Rio de Janeiro are in separate states. So they report to separate state governors. Right? So it's a pleasure now. I missed someone on my list. I beg your pardon. To introduce Joelle and Stephen, who's from Peru. Sorry, Peru. I'm thinking about South America. Purdue University Northwest in Hammond, Indiana, in the United States of America. We've had the third wave in the United States may well have started, and it may well be a consequence of colleges and universities and secondary schools coming back onto campus. So we look for some insight from Ms. Stephen. Thank you very much for coming.
Thank you so much. I'm happy to be here. I appreciate you having me on this to speak tonight. So as mentioned, I work for Purdue University Northwest. Right now, I technically work in a career center. So I help students with their career paths, figuring out what they want to do. But I'm also a licensed mental health counselor. So I was asked to kind of speak on the social situation regarding COVID. So I think the key too, and what was mentioned about campuses opening and students coming back on campus, I know that's happening for a lot of institutions, and they're quickly having to transition to online because of the increasing numbers of COVID that are occurring. Our institution in particular is actually doing mostly classes online. So we haven't had as many cases. given that. I know I teach a few classes and they have been online, but it's definitely impacted the students in significant ways, as well as I think just everyone here in the US and around the world. So I just wanted to, again, touch on the social situation and kind of mental health aspect of this. So I think the key with COVID is that people all respond differently to different stressors, right? And COVID has been a huge stressor for people everywhere. And so increasing mental health issues, right? So people who have pre-existing mental health concerns or conditions, this can be made worse because of COVID. So people that struggle with anxiety or people that struggle with depression may feel even worse during this time. And also, I've read a lot of articles, a lot of research on how issues with substance abuse, with alcohol issues, because the stress that people are under right now. And so that's something to be aware of, I think, during this time, that your mental health may suffer and you may be struggling. And we all respond, like I said, differently to that. There's also been economic hardships, right? Loss of jobs in the US. I know many people personally, given that I work with students with their career, a lot of internships have been canceled or turned down due to this pandemic because the employer simply can't afford it, or they can't have the student on site due to COVID. And this has happened quite a bit for our students. And we've seen this, as a trend. And I think it's going to continue until obviously there's a vaccine or something that we're able to do because of COVID. There's also just the decreased feelings of being safe, right? We all, for our mental health and stability, want to feel like we are safe in our homes, safe in our communities, safe in our countries. And a lot of us aren't feeling that way, because even to go to the grocery store, you're putting yourself at risk. And obviously wearing a mask and keeping social distance is helpful, but that also can be harmful to our mental health. We should do it because that is what to help to reduce the risk. But I think there's other things that we can be doing to help make us feel better during this time. So some simple things, for mental health, right? You've probably heard this before, but getting enough sleep and keeping a consistent schedule during this time, because, we may be up late worrying and having anxiety about what's going on in our society. So doing that, and while we all need to be aware of what's going on and good consumers of information and having correct information, it may be best for some of us to limit how much news we're taking in, because I think it can be almost overwhelming for a lot of people because we're constantly bombarded with all of this information. So maybe just watching once a day or whatever that is for you, cutting back a little bit with this. And it's still very crucial, I think, to make connections with other individuals via online, just like we're doing tonight. I think that's very important for us and our stability. Whether that's your family calling on the phone if you can't do Zoom or things like that. And even, with depression, there's a lot of research that this sounds like a simple thing, but it's been shown to work. Keeping a gratitude journal, even if each night you write down 3 things you're thankful for, it's been shown to improve depression symptoms. So even just 3 simple little things like, you have water to take a shower, or you had a good meal that night, or, you were able to talk to your mother or father or whoever it is. Those things, those little things are going to help. And another big thing is, acknowledging your emotions. So I think we're told a lot of times that when you feel sad or upset or scared, we kind of hide that and push it under the rug, when in fact that's not good for us. We need to acknowledge the way that we're feeling and communicate that with someone that we care about, right? It's helpful to do that. And then lastly, connecting with others and maybe our faith-based communities. So for a lot of people, that's a source of comfort, that they're able to reach out to that community that they have built virtually, right? So again, this virtual environment is very important during this time. And then I just kind of want to close by saying that this time is very uncertain for us, right? We're not sure when a vaccine is going to come through. We're not sure how much longer all of this is going to go on, how much longer we're going to have to wear masks, and be away from our loved ones. So dealing with uncertainty is very important. So I believe that, trying to envision the best case scenario instead of always worrying about what is going to happen that's bad, right? I understand that some situations can't be avoided, but trying to keep a fairly positive mindset. And again, not to avoid our feelings, being able to discuss with one another what we're going through and sharing that experience with someone else can be very, very helpful for our mental health. Thank you.
Thank you very much. It's very compelling. So let me just ask you a couple of questions. So you've gone to all online, or you still have on-campus students?
So we do have a couple on-campus students. A few classes are hybrid, but their masks are required if you're on campus at all, and then there's cleaning supplies in each room. So that has to be wiped down before and after class. But those are very few, and they've limited the number of students in those classes. But mine are all online.
So they're like laboratory classes, or is that kind of the idea? Okay.
Yes, exactly. Mm-hmm.
So across, so if people aren't following this conversation, there's no reason for you to. The United States has had to close big universities and send at least undergraduates, the bachelor's level students home, which may not be the world's best idea. You may want to keep them there. There have been big outbreaks of 1,000 students infected in a very short period of time. And all I can say is that beer is a wonderful lubricant for disease transmission in many ways. So that's what we're seeing. And so we've had to go. There's a lot of bouncing around, going from in person to online, back to in person. And some of the biggest university systems in the United States have said, "Forget it. We're just going to go online the whole year." Yeah. And it's imagine paying a lot of money to go to Harvard or something and not, and watching it on TV the whole time. It's pretty discouraging. But I think, resilience is an important thing. Mm-hmm. I have one question, if I may, for Dr. Babu. In California, at least, in the U.S. at least, there's a lot of pre-screening of dental patients. It struck me as you were talking about your infection control precautions, how somewhat different they were than the ones we're doing at my university. And one of the things we really push is testing people before really any procedure, but especially aerosol generating procedures like drilling out some nasty old tooth, and where it's going to be kind of a vapor of saliva and everything else. You can have a halo around them. Is testing just not that available? Have you thought of that, or why have you not gone down that path? I mean, there are a million reasons not to go down that path, but I'd be curious to hear your thoughts on that. For Dr. Babu, please. I think she asked to unmute. Yeah. We need Dr. Babu unmuted, please. For Dr. Charlene to unmute, please.
Hello, can you hear me?
Good.
Dr. George,
yep,
can you hear me?
Yep. We're good.
Is as preliminary investigation, like not investigation, as preliminary screening, we mostly depend on temperature checks and epidemiological status. We normally ask the patients from where they are coming from, any containment zone, like that. So depending upon that, we will classify the patients. Then here in Kerala, actually, the government hospital or the government setup is taking care of the COVID patients. So in private institutions, we are not treating those COVID positive patients actually.
Mm-hmm. I'm sorry, go ahead. Go ahead, please.
Yes, sir, please. I didn't hear you.
Yeah, can I just ask, so even if you wanted to test them for COVID before you did procedures, you'd have to send
Yes,
them to the governor?
we have facility to check for COVID-19 tests. We have facility, and we will be getting the report whether it is positive or negative within 24 hours. And normally here in Kerala, like the government is taking care of all COVID positive patients, and few private hospitals also have the privilege to treat them.
Thank you. Can I just come back to like one last lightning round here of questions for some of our speakers. So Dr. Kuryakose, how do you see this ending in India? Is it going to end It's not going to end well, I can tell you that. But is it how disruptive is this going to be, say, 5 years from now? Will you know it had happened? Will there be lasting scars?
Dr. Rutherford, I'm an optimist. I think that definitely this will test the system in a big way, the healthcare system, economy in a big way. Uh, sorry, yeah, in a big way. But the initial, the peak of the pandemic, we believe that will go on till about December or so, and then it will gradually come down. That is happened in almost all the other part of the world. Similar pattern we also will see in India, but
Mhm.
end soon. Even with the vaccine, we should not hang our hat on a vaccine. Vaccine, it's getting the logistics of giving vaccine to the large over 1 billion population is not an easy task. Moreover, the effectiveness of vaccine, the side effects of vaccine, nobody has tested. So it is just have to, nature has to take care of itself, and this will have repercussion the economic side too. But we will come around. We will going to live in a better world with more technology to adopt to the new norms.
Thank you. I hate to tell you this, but all the vaccines in trial now have 2 doses, so you're going to have to vaccinate them twice. But just another cheery thought for your optimistic framework. But I'm with you on optimism. Um, uh, Joellen, if I may, how do you see this? Where do you see your campus a year from now, 2 years from now? Are you still going to, are people not going to graduate and you're going to have big, kind of a big sort of bubble, like the egg going through the snake? Are you going to have a big bulge to get people out? Is it going to be a long time to come back to what you perceive as normal?
So I think that, I'm not exactly sure what the future will hold, but I do think that it will take a while to come back to normal. Even because I know a lot of students are struggling, as you kind of alluded to, with the online environment, right? They pay all this money, they go to school, and then they're not acclimating well to the online classroom. So I think it will stop a few people from graduating on time because they may hold out a semester and then want to come back later. So we may see a surge that way. And then in terms of just jobs and internships, I think, there are still companies hiring because I'm still getting emails and calls asking for students. But at the same time, it's less, right? So I think it will also impact our students as they're going towards graduation to find a job maybe as quickly as they would have previously, unless they're able to work remotely. So I think that will have an impact on our students as well.
What do most of your students go into? What kinds of fields? I always
So
think
I specifically work in the College of Business. So I work
Okay.
with all business majors. So anywhere accounting, finance, business analytics, human resources, etc. So that's kind of my area.
Okay. And so you see them, I mean, there'll be jobs for them. And
Absolutely.
people hire, among other things. Yeah.
Absolutely. There will be. Yep.
Okay, so if I could just come back to Dr. Savino, finally. So 5 years from now, will you know that this happened in Brazil? Will you still see cicatrices? Will you still see scars?
Um, 5 years from now, depends on public policies, actually.
Yeah.
I think that one of the great lessons of this pandemic is that the huge inequalities actually is a horror for everybody, including poor people, but not only poor people. So increasing the quality of life of poor people will be a major difference, but requires, unusual decisions, let's say.
Mm-hmm.
And we are speaking about a country with 220 million people. So with a very high concentration of money in very few hands. I think that science has made a major role in the Zika epidemics, and again in COVID-19 pandemic.
Yeah.
Again, we should emphasize funding for science, which is not the case by now. On the contrary, it's been reduced so that to be much more prepared.
Yeah.
So I think that the scar will be a mix of the virus with public policies.
Thank you. I think it's going to be much the same in the United States. It sort of all depends on who's elected the next president as to whether we can move to rationalize policies or not. I assume it's the same in Brazil, although I'm not sure when Bolsonaro is up for re-election. But it's something to be cognizant of. Yeah, I mean, and I think we're going to have vaccine here pretty quickly.
Yes.
But, you know, but that's just in the United States. I mean, right there, we put up the walls. You know, God knows we're not going to give any vaccine to Canada. You know, I think it's crazy, right? You know, this is if anything ever called for international cooperation, it's something like this. But
you know, when you hijack equipment at the airports, that happened.
Yep. There's lots of stuff that happened. I could turn your hair would turn white. Mais branco. Okay.
Okay.
Whiter, not white, whiter. Well, I think with that, Dr. Kudikosi, Father Kudikosi, I think we can wrap it up here. I'd like to thank all the panelists. I'd like to thank all the speakers. My apologies again, Joellen. Yeah, I think it's been a really robust discussion, and I hope that there's a terrific that the conference goes really well tomorrow or later today, depending on what side of the world you're on. And this is really kind of a remarkable feat with Zoom to have people beamed in from all over the world. So thank you all very much. It's been a real pleasure. Thank you.
Thank you again. Thank you. Bye-bye.
Yeah, thank you. Bye.
Bye-bye. Thank you.
Bye.
Okay, great. Good. Thanks. All right, over and out. Thank you.
They cannot see us.
Hello, Professor Kuriakos.
Yes.
Thank you very much for the wonderful beginning and congratulations. I'm very happy. And we will begin our program India time 9:30 a.m. Now here it is 9:10. And all our panelists are online. So once again.
Yeah, we, the Greenland group, are taking a long break for the night.
You have to take a break.
Yeah. In Brazil, it is midnight. So.
And in California?
We are 8:45. 8:40 in the evening.
Oh, you are very early.
Yeah, we are very early.
Okay.
Thank you.
Thank you, Achin.